Sorry about that. I had to change computers.
Welcome.
Erin.
Hi, Erin.
Hi.
Good afternoon, everyone. Thank you so much for joining us. We are just waiting for one more panelist, but we'll get started.
Looks like Han's here.
Han is just joining us right now. Hello. Great. So I think we'll get started if everyone's okay with that. Great.
Looks good.
So hello, everyone. Thank you so much for joining us for our very first trans healthcare panel. My name is Quincelise. I use they, them pronouns, and I'm the Associate Director for the Resource Center for Sexual and Gender Diversity. And I'm gonna pass it on to Dwayne Mosby to introduce himself, because he'll be helping with the IT for this panel.
Folks, even though my picture will not be here, I will still be in the room helping with tech. My name is Dwayne Mosby. My pronouns are he, him, his, and I'm the program coordinator for the Resource Center for Sexual and Gender Diversity. Thank you all so much for attending.
Thank you, Dwayne. As an FYI, this webinar will be recorded and it will be later included in our RCSGD YouTube channel. So watch out for that recording on our YouTube channel, just so there is a lot of students that were not able to remote in live. So we wanted to make sure that this information was accessible for students who were not able to be here. But with that said, I wanted to start off with the land acknowledgement. We wanted to acknowledge that some of you who are remoting in might not be in Santa Barbara or the local area, but for most of us, we are in Santa Barbara. So I wanted to acknowledge that we are on Chumash land. And I really encourage you to do some research and figure out like what our Indigenous communities at UCSB and also in the surrounding area need your help right now. But currently there are a lot of petitions and the movement to remove racist statues and names in Santa Barbara. So I really encourage you to look at those in your local community to see how you can support removing you know, the statues and really racist names that remind us the genocide of our Indigenous community members. And with that being said, I want to turn it to our panelists to do some quick introductions. So if we can maybe go around popcorn, so popcorn is like just someone start and then someone nominate the other person to continue, but name, pronouns, position, and what you've been up to in this quarantine, because I know there's a lot of crafts going on around here. So I'm wondering if anyone would like to go first.
I'll jump in. Thanks, Quinn. Thank you for acknowledging the Chumash. I'm Janet Osimo. I'm a psychologist and the assistant clinical director at CAPS. And I appreciate you kind of giving us a directive in terms of how we can help the Chumash rather than just acknowledging that we're still on their land. So thank you for that. And just in terms of COVID, I joke about having COVID goals. And one of my primary COVID goals has been perfecting the martini. So I usually on Friday afternoons, I work on my goals. Not just yet though, so all tea. So I also run the True Selves group and have been running that for about 5 years and hope to continue that in some form, maybe not on a weekly basis for the coming quarter. But thanks for being here. And I nominate Emily since she is also working in CAPS with me.
Great. Thanks. I'm Emily Maynard. I'm a clinical psychologist, and I also am at Counseling and Psychological Services. For the last 2 years, I've run a group for students who identify as transgender or non-binary. It's a support group. It's a confidential group through CAPS. And like Dr. Osimo, I'm hoping to run it in some capacity this fall, but it may not be on a weekly basis with a Zoom format. I'm trying to figure out what would be best for students. But it's been really well attended in the past. It's been full every quarter. So I'm anticipating that there will be a need to hold space for that. quarantine goals. Well, I do weaving, so I've been doing a lot of weaving, and there's some of mine. Yeah, I use the pronouns she, her, hers, or ella in Spanish. And I nominate Angie. Magaña.
Thanks, Emily. My name is Angie Magaña. I use she and her for my pronouns. I'm a certified nurse midwife, and I'm a nurse practitioner here at Student Health Services, UCSB, where the majority of my work is all around sexual, reproductive, pelvic health care. I am a lesbian. I identify myself as part of the queer community. I would like to acknowledge that I have this beautiful Latinx last name that was gifted to me by my wife. But generally, I have enjoyed the privilege that goes along with being white in this world that we live in. So I just want to acknowledge that. During COVID, I've had some interesting experiences because I moved from our starter house that we moved into in Santa Barbara when we moved here a year ago. We moved from there, which was downtown, into what I hope to be a forever home in San Roque, and we're still moving in and getting everything squared away. I'm going to pick up a Craigslist desk tonight that I'm really excited about so that I can have an official space to do my at-home Zooming and also my crafting, which I love to do. And I am going to nominate Betsy.
Hi, I'm Betsy. I also work at Student Health, and my job there is many, but one of the ones that I do is I'm a dietitian, and my specialty is eating disorders, and we have an eating disorder group that we like to run. Robbie, someone from CAPS, and I run, and we're hoping that we'll be able to do it again in the fall. If we can work that out, we will be doing that. Yeah, I don't even know what to say about myself, but I've been really, 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 really busy. I haven't had any downtime at all because student health has been in need of the kinds of things that I do when I'm not being a dietitian. So that's my COVID thing. I'm kind of pissed that I don't get to do more crafts and do something other than student healthy things. So that's me. I nominate Han.
Hello, friends. So I'm Han. I use they, them pronouns. I am trans and non-binary. I'm the health equity advocate, so I sit at the intersection of student health, CAPS, and health and wellness. I am also a grad student, so a lot of how I have been spending my COVID time is being a therapist at Isla Vista Neighborhood Clinic, which I finished Wednesday. I don't know what day it is. And doing a lot of writing, and I've also been studying Spanish. So my Duolingo is how long I'm into the pandemic. That's kind of how I know the beginning of my social distancing. So I'm like on day 136 right now. And it's helpful to just have that reminder, like it's been a while. So yeah, I'd love to hear from Erin.
Hi, thanks, Han. My name's Erin. I use she, her pronouns. During this quarantine time, to be honest, I've been working in urgent care, so I've been seeing a lot of COVID suspects, so that's what I've been doing a lot of. And then at home, I have young children, so I like to sum it up that we've been having a lot of bike rides, bruises, and Band-Aids. However, just kidding, not really the bruises part. But we've been busy, and I'm trying to, when I can, get outside of my home box and be out in nature as much as possible. Thanks, Han. I'd like to nominate Shireen.
Hi, everybody. My name is Shireen Barr. I use the pronouns she and her, and I'm a social worker at Student Health. And part of what I do is to help transgender students, LGBTQ+, with a variety of supportive services, including things like explaining our UC SHIP anthem insurance, approval process for gender-affirming services and surgery, and things like identifying surgeons, as well as other service providers. So that's a kind of a small piece of what I do. And what have I been doing during this period of time? What I enjoy doing most definitely is experimenting in my garden, which has taken over a big part of my backyard with different herbs and vegetables. And it's been really a lot of fun and quite delicious. Aside from that, I just sort of roam the neighborhood, and I've found some interesting secret pathways up in the hills here. So it's been a good diversion from my work. So I'd like to pass it on. I believe, is Craig here? No?
He's you can introduce.
I am here, but I'm a background participant. Thank you. Hi, everyone. My name is Craig. I use he and him pronouns. I'm the director of the RCSGD, and similar to Dwayne, I'll just be in the background supporting however I can. Thanks, everyone, for being here.
Thanks, Craig.
I love when we put people on the spot and they have
Surprise!
Craig has no COVID goals.
Oh yeah. So thank you so much for doing those quick introductions. For folks that are joining us, if you have questions for these panelists around trans-affirming healthcare, mental health care, really any trans-related services and resources at UCSB, feel free to add your questions in the Q&A section of this webinar, and we'll make sure to ask those to our panelists. And so I think we're gonna move on to the next question, if everyone's okay with that. And this is more of like, whoever wants to answer can answer, not everyone has to answer every question. So feel free to step in, step out, however you wanna contribute to the conversation. So please tell us a little bit more about your role on campus and what resources you provide for trans, non-binary, and questioning students.
So I can jump in here since I said the least about what I do. So as a health equity advocate, my role is to help bridge those health gaps. So we know that across the United States and across beyond the United States, people get differential care and have differential health outcomes based on their experiences of racism, sexism, homophobia in the world, and also in clinics. And so my role exists to say, how can we make sure that all of our students are getting good healthcare and getting good health outcomes, regardless of their experiences of stigma? And so I see my role as understanding how stigma affects UCSB students and helping create some novel solutions and make sure that the solutions are actually really working. So some of what that has looked like has been with health and wellness over the last year, doing some new research and expanding some research that has previously existed to make sure that we were getting enough participation by trans students to be able to pull out. Like we've been doing the National College Health Assessment on our campus for many, many years, every 2 years, but it was a random sample of students. And of course, trans students make up a fairly small population of the overall population, which meant that we were able to identify trans respondents, and we had trans respondents, but it was like, well, there's 10. So we can't really do a comparison group. So we can't, even though we were asking all these great questions. And so looking at that, we were able to say, well, we really need this data in order to know what's going on for trans students. And so we shifted from a random sample to making the National College Health Assessment available to every single student on campus. And that meant that the last time we ran it, we were able to pull out actual comparison groups, and not just for trans students, but also for other underrepresented groups on campus. So we were able to have enough Black respondents, even though Black students are very underrepresented on campus, to be able to say what's happening medically for our Black students and how can we be supporting the health of our Black students specifically. We're also talking about how we can create some new feedback systems that help support providers by giving them the feedback that they need in a way that's usable and helps really support people without relying on the kind of shaming, blaming, secrecy generating systems of punitive responses that we know don't serve us and that a lot of people are really hesitant to use even if they really want to give feedback. So we're looking at like, what else can we do to help people have a good relationship and a trusting relationship between care seekers and care providers, because that's what we all want.
Thank you, Han. Jenna and Emily, I'm wondering, you all both mentioned 2 groups that you run. Do you mind speaking more about the groups? Like what's the intent? Maybe what's like the curriculum? I'm not sure if that's the right term. Maybe speak a little bit more in case there are students listening who might be interested in joining your groups.
Sure. So True Selves is for LGBTQ students and primarily for undergraduates. Every now and then we have a graduate student in there. And prior to the transformative group, you know, we really had the whole gamut. So now that Emily's running the transformative group, which she can speak to a little bit more in a moment, you know, now it's, you know, it's still very mixed in terms of, you know, folks who join. It's a process group. So basically we talk about what students need to talk about that week. So we don't have a curriculum. We don't necessarily have a topic even. I've been running it, you know, as I said, about 5 years, and every quarter is different. I don't require a, you know, 1-year commitment or what have you, but I do ask that students commit to at least a quarter. Just because by the nature of groups, you know, you have to get to know one another, to open up and chat and what have you. So it's been really successful in that regard. What else can I say about it? So I think this quarter, in the summertime, in the fall, I might run it maybe like once a month. And it might be a little bit more topic driven. Part of that is because just with Zoom and having to schedule another weekly meeting seems to be a lot for students. We have run groups since COVID started and quarantine started, and the attendance is lower, which is fine. It doesn't mean it can't be useful. But I think just as much as we all are on Zoom, we're, at least for myself, we're going to limit that a little bit more. So it's going to be a little bit more intentional just in terms of topic and the limit around the time, just so people can, you know, make room for it rather than committing to an hour every week on top of what they're already committing to on Zoom. So anyway, so that will be coming in the fall. So keep an ear out for word about True Self starting again. Emily, maybe you can say more about Transformative.
Sure. Yeah, so the group that I've run is called Transformative, and it's open to transgender, non-binary, and questioning students. It's very similar in structure to what Dr. Osimo described in terms of being a process group. So I don't come in as the therapist saying we're going to talk about something this week. It's really driven by what students are going through and what they want to talk about. But that said, there were some similar themes that would come up. So students often what I really loved about the group was that there were trans masculine folks, trans feminine group folks, and non-binary folks. And so we really got that diversity across the trans spectrum. And I think that there was a lot of learning that took place among students of like sharing what their experiences had been, the differences as well as the similarities. Also just different places in terms of students that were more out and had been transitioning in one way or another, to students that were still like, I'm not really sure if I'm trans, but I want to talk about it, and where can I talk about this? And so they would come to the group. And really, it was a pleasure to see people make some decisions too and decide like, hey, I'm ready for, you know, to start using a different name or different pronouns, or I'm ready to go to student health and to get connected with a provider there and talk about hormonal therapies or other treatments. So I was really excited that the students were requesting this group. That's how it came about, was, you know, student advocacy, student requests. And it was a community I was interested in working with, and so that's how I had the role of the leader. And this last year we had a trainee, an advanced psychology student, Sam Del Castillo, was co-leading the group.
And just to, we also have trans folks in our group as well. So there might be some wondering about, well, why would I go to True Selves and why would I go to Transformative? You know, what's the difference? And it's really about where the students is at. So what I have found is folks who want to come to True Selves rather than Transformative, maybe they're not sure, or maybe they're not even, they don't really want to talk about it yet. They're just sort of feeling it out. Or so they're usually in their early stages. Sometimes trans folks who have come in the group, they feel like they wish there were more trans folks in the group, or they want to be more, you know, so there's sort of this sometimes difference between, you know, folks who are more LGBT identified and trans identified. So it's really about where the student's at in their comfort, you know, and where they are in their journey. So, and what we do is usually talk to students before they join, just to get more information, and, you know, they can ask questions and that kind of thing to maybe even help clarify for themselves what would be the most useful.
We should also mention, Janet, that at CAPS there are clinicians such as ourselves, but not only Janet and me, who also provide individual therapy to trans and non-binary students. And so that has, as I've started the group, I've gotten more students who also want individual therapy and want to work with a provider that has some experience working with trans issues. So I do see just an individual therapy a fair number of trans and non-binary students, as well as LGB.
Yeah.
And there are others as well who do that work.
So I'd like to jump in just for a second, because a lot of people get kind of freaked out about dietitians and think, they're just going to dive into food and shame and all that other good stuff. That is not at all my MO. For me, when I'm working with people, is trying to understand where they are, who they are, and what works with their body, their life, their soul. Because food should never, ever be a punishment or even a reward. It just is food. It's delicious and it's intrinsically rewarding. And there should never be any shame or blame with that. And a big part of what I do is also work with people with body image issues. And we know that that's a big problem, in particular in the trans community. And so I like to just leave my doors open as possible for people to feel safe coming in and talking about almost anything around their food and their body, because it is really a big issue for everybody, both so many people. I wish it weren't, but it is. And I just wanted to put that out there.
I think I can speak now. So I'm a board certified internal medicine physician. I consider myself a primary care physician. So really, you know, I'm here to help with any need that I can potentially help with and try to provide a safe and open space. In terms of resources for the trans, non-binary, and questioning students, like everyone has mentioned, I want to meet you where you're at and help you with whatever need you have at this point in time. I provide one-on-one medical advice and treatment. Those things might include testosterone, estrogen, maybe progesterone, hormone blockers, and other treatments. Personally, I feel that this should be a skill that any primary care provider should be able to perform. I think that this should be accessible to everyone. I think it should just be part of the standard of care. that's my goal. And I think that student health is trying to strive to have all providers be able to provide this care. And in any case, I'm here for you for whatever you need.
I'm going to chime in now. I did mention that I assist students with the complexities of the insurance business, and I'm happy to navigate that with students. In addition to any other navigation issues related to your needs. That could include community resources, UCSB system-wide resources, and any navigation support issues or concerns that you may have. I'm more than happy to work with you on whatever presents and that you need assistance with. So it's more of a supportive role that's kind of broad, but also specific, because the insurance piece is a little bit complicated, as most insurance business is, but I want to make it less so and less of a barrier. And it doesn't have to just be UC SHIP. It could also be your individual insurance, private insurance. If you don't have insurance, we can work on those challenges together to get your needs met. So I just wanted to put that out there. And how you would reach me to schedule an appointment to discuss that is through the phone number at the Sierra Clinic for an appointment. That's generally the way we make appointments with social work. And that number is 805-893-3087.
Thanks, Shireen. I think I'm the only one who hasn't spoken. I just want to say I lean on all of these people here so much, and I feel really lucky to get to be part of this team. I've only been here a year, but everybody really welcomed me with open arms, and we all kind of hit the ground running to make the program what it is and what it continues to be. The big part that Erin and I do as the medical providers is the medical piece. And so we know that being gender diverse is not a disease. It's not a pathology, but it is a condition. It's a way of being. And if you are so inclined to use hormones, those are prescribed. So those have to be prescribed by a medical provider, myself or Erin, or hopefully many other providers here at Student Health one day will be also on board to do this. But we're here to just keep you safe while you do it. We're not here to police it or hold it back. We're just here to tell you this is what's possible. This is what's available. This is how you stay safe. This is how we move you through this process. You're the boss. You tell me when you are in a place that you feel comfortable in your body. You tell me what you need to be comfortable in your body. Shireen is amazing at navigating all of that insurance stuff that just blows my mind. And I cannot even with the insurance for myself. So I get it. But we're here to answer questions. We're here to tell you, that's okay. That's, this is just the way, that it is. It's easy enough to, I think it's easy enough to get in to see Erin or I through, I think you can just, like the normal appointment line, you can just call that. We had it set up where you could go through our advice nurses, but now they're all COVID all the time. So unfortunately that entryway is blocked. But I think you can also get in touch with Erin and I directly through the portal.
If I think another added thing that we do provide, that we get referrals from Angie and Shireen and Erin and what have you, is if you are at that point that you might need a letter for surgery, then you can contact us directly. You can ask, just tell the front desk that you need a letter for surgery, and they know to schedule you directly with me or with Emily. So, and you can also, there's also an online request form, and just let them know that you need a surgery letter, and you can bypass the brief assessment. So, And then what that looks like if you do come in, it's, you know, just a couple of sessions. One is, you know, fairly full intake, getting a history and what have you, just because that's what the insurance requires. And then the next time is really me going over the letter with you and making sure it's to your, you know, liking, if there's any changes or what have you. And then we provide the letter. So it's a pretty straightforward and quick process.
Thank you, everyone. I just am so honored to be in a panel, right? Moderating a panel with such such knowledgeable folks and so dedicated to supporting our trans, non-binary, and questioning students. So I just, as the associate director of the RC, right, of the Pride Center, I typically meet with LGBT students, especially trans students, as I am also trans, and I really rely on all of y'all, and y'all are always so prompt and so quick, and always get the resources and services to students. So I want to thank y'all very deeply from the RCSGD, because you'll make our jobs a lot easier. So thank you so much. Janet, you mentioned around you know, gender affirming surgery. So there was a question that a participant had about like how would a student start that process? They know that they want to have you know, either top surgery or bottom surgery or you know, another gender affirming type of surgery. How would that process start?
I can start with that. If they have, I mean, they can always schedule an appointment with me regardless of their insurance status. And I'd be more than happy to help them begin and enter into that discussion. And that's usually how it begins. On our student health website, there should be a new gender affirming benefits checklist for the next calendar year, which starts 9/27 with the Anthem Blue Cross. So that can give you a little bit of insight to the benefits, and that might be a good place to start as well, just to get familiar with that. And then we can go more into detail about what that means for the individual.
Yeah, and my experience has been that physicians usually want a letter before they even make the consult. So you would probably stop at CAPS before you have your consult. And the letters are good for up to a year.
The generally required for the gender affirming surgeries are a letter from your prescriber or from a medical health professional, and then a second letter from a mental health professional. Using hormone affirming therapy is not required for most surgeries, but being in consultation with a medical provider is. So it would be a referral from a medical provider, a mental health provider, and in the case of bottom type surgeries, it's usually to mental health providers, 2 separate letters, or 1 letter that 2 people have uniquely signed themselves. And that gets you to the surgeon, who then does the consultation and talks you through everything. And then it's the surgeon who then submits the ultimate actual surgical request from the insurance, because they are the ones ultimately performing the surgery who have the final say about the type of procedure that will be done.
I just want to add that although right now there's this legal requirement for mental health and medical providers to provide letters, and we have this gatekeeping function, my attitude is that I need to affirm a student's choice. I don't want to be serving like a punitive gatekeeping role. And so yes, as a licensed psychologist, I have been granted permission to have that role, but I approach these letters and this relationship as helping a student think about what the decisions are, think about what they want from the surgery, and just as I would with other kinds of medical procedures with students, think about the risks and the benefits. but not that I am deciding whether or not this is appropriate for a student. If that makes sense.
Right,
I'm
thanks
so
for
glad that you
explaining
said
that,
that.
Emily. That's a really important point.
Yeah, I do just want to clarify that this is a purely economic policy. It's not a law. It's just that insurance companies very consistently refuse to cover this care without these letters. But there's no scientific or legal justification. And in fact, people are really moving away from this. So hopefully in the next few years, we'll see this practice end. Because there's no test for what your real gender is. We're not actually qualified to test you on that.
Yeah,
Really good to hear, Han.
I agree. So I look at it as, you know, an insurance business practice under it's entitled pre-certification. So it's a pre-certification process to getting the services that you desire. And it's a bureaucratic process. And, you know, I see myself as trying to make it easier to go through those hurdles so it doesn't become a barrier or a nuisance and make anybody anxious. And honestly, it doesn't have to. And I will say, I've been doing this for 3 years now, and I have seen progress in that direction within the insurance framework that we're working within, where it's getting easier. And maybe that's from my bias because I'm getting more used to helping students with that, but I truly think that they are working at making it less a challenge to get these services provided to our students. So that's the positive piece of it. But yeah, and that's why, I mean, we're here to help you through that process and provide a safe space to do so.
Yeah, I want to say more about that also is that, you know, what they want to see is basically 3 things. 1, do you meet criteria for gender dysphoria? 2, can you, you know, are you sort of of sound mind that you can make this decision? And 3, if you have a mental health consideration, is there that mental health consideration going to impair your ability to make this decision? So it's just those basic 3 things. And to Emily's point and Shireen's point, you know, we are in a position, and I think we all have this philosophy, is we're here to help you get the checkbox. And that's, you know, unfortunately it's the way it is right now. I don't, as Han said, hopefully it won't be like that for much longer. But essentially that's our goal when we're meeting with you, is to just see if, you know, we can give the insurance company what they want. So it's pretty straightforward.
And having another mental health condition would not disqualify you from the surgery.
No,
Or a physical health condition wouldn't disqualify you either. I think the conversations that we have really revolve around like expectations and understanding that you really understand what the surgery is, what it does, what does the recovery look like. You know, I think the surgeons are surgeons, and not a lot of them always have the time or the wherewithal or the bedside manner to really go through everything with you. And so if we can go through that and say, oh, you wanted to do your bottom surgery, you know, next year because you have a week off from work, well, how about like 6 months is what you need? And how about you understand, we are going to talk about this is what this means, and, you know, dilating on a daily basis and having, you know, medical providers all up in your business all the time. It can be really traumatic. So I think if we can kind of set you up for success in that way, that's really what these kind of surgical letters and surgical permission thing is all about, I think.
Thank you so much. I think because they're around trans healthcare, there's not a lot that, like, a lot of information out there. It's mostly within community. So it's really great to have such a panel that has those expertise available. And, you know, when I meet with students, oftentimes they're not even there, right? They're not even to the point where they can actually see a medical provider to even talk about surgery. So Hannah, I'm wondering if you can maybe talk about your process when you're supporting students in wanting surgery, or what does that look like?
Absolutely. So I think I sometimes see students who are kind of in between the Janet and or Emily phase and the Angie and or Erin phase. So I see people who are like, I know that I'm trans and I don't really know if I want medical transition, or I might, or I just have questions. And so often people come to me when they want to talk to somebody and get some information that feels a little bit more off the record. So I can talk a lot about what the process is, who they might want to talk to, and kind of do some planning together without it feeling like it's part of the care package, because I'm not a prescriber. I'm not a letter writer at UCSB. So I'm a little bit more, yeah, like I said, off the record. So people will come in with me and ask questions about hormones and kind of start exploring whether that might be something that they want. Or sometimes they'll come in and say, you know, if I decide that I want this, what are the steps that I should take? What should I expect? How should I approach this? If they want a little bit more support in finding a surgeon, or they're not sure who to talk to, or what kind of services they might need, or what services might mean, they can come in. And sometimes I'll say, hey, you know, it sounds like you're navigating a lot of complexity around having family that's not really joining you on this project yet. So you might want to talk to Janet about how that's affecting you. And it sounds like you have a lot of stuff wrapped up with food and body image. So you might want to talk to Betsy as your, so often I'll end up referring people to multiple folks within the system and say, yeah, it sounds like you're totally ready to start hormones, and here's who to ask for that. And here's who to talk to about the other supports that you might need. So I think anybody who watches this video is going to be in great shape because they'll have seen all of us. Although not all of us, there's also more people in all of these on-campus agencies who are involved in trans care. So this is not even the whole picture, which I have to say I'm just deeply enjoying today, seeing us together, and yeah, it's a treat for us. But yeah, pointing people out. And sometimes I think one of the gifts that I get to give students is I know a lot of the providers really well. And so I'm often able to say, oh, I think that you would fit this person really well. Whereas they might be looking at just a list of providers and picking kind of at random. I could say, oh, you know, you're trans and an immigrant, and I know that this specific provider really cares about immigrant students and is very informed about immigrant students in addition to being on the trans care team. So this provider might be the perfect fit for you. Whereas, you know, if they're looking at a list of names, they might be going, that person is alphabetically on the top and not know. So I think one of the really phenomenal things about the place that we are in our move from kind of building up individual specialists towards being in that place that Erin talked about, where everyone's ready to go. We're starting to get closer to that end, and we do have so many more people that we can refer to. And I think that can be a little bit confusing for students, but it's also phenomenal because it means we can get those really good fits. And sometimes that gets to be the thing that I do. And sometimes it's finding those additional kind of specialized questions. My first week on the job, it was one of those 15 minutes before close of business on my first Friday. My medical director came into my office and said, "Can I shut the door?" And I was like, okay. And it was like, okay, there's a student who is in another state right now and needs emergency housing for an HIV positive trans student right now. Can you find that? And I was like, I don't know. So I think that one of the really great things about my job is I don't have a lot of borders. So I have a lot of flexibility. So when things come up that are like, we don't have any idea how to solve this problem, but we need a solution, sometimes that gets to be my job. And another thing that students can come to me for is if something goes wrong, and really, whether that's on campus or off campus, if something goes wrong at Cottage, you can still call me. If something goes wrong and you need help figuring out how to get the care that you need, or figuring out how to navigate feedback systems, or you need an advocate, or you're nervous to go into an appointment alone and you want somebody who's just going to make sure that you get gendered correctly, you can reach out to me and I can help.
Thanks, Han. I think that's excellent in every way. I just, back to the insurance piece, I think I left this out, and I think this is a positive change that I was referring to before, is that for the 2020-21 insurance year, we have added benefits, which are gender-conforming facial surgery benefits that are new this coming year, which are excellent. And the deductible is actually going down $100. So it's going from $400 to $300, which is really welcomed. So so it's becoming more accessible and more expansive. And, that's headed in the right direction. So there's a lot to be grateful for. We tend to think about what's not going right. Well, I'm looking at, well, this is going well. Let's keep it going. So I just wanted to put that forth. So, and if you want more information about that, again, you can reach out to me about that. I'd be happy to go into the nitty-gritty of those benefits.
Yeah, actually, there was a question that a student asked around what is covered under UCSB around trans-affirming care. Of course, I don't expect you to name every single thing, but maybe like a brief overview.
Sure. So as we mentioned before, top surgery and bottom surgery. That I wanted to highlight those additional benefits, the gender-conforming facial surgery benefits. Those for male to female transitions, they would include something like a brow lift, forehead contouring, cheek implants, jaw and or chin reshaping, lip shortenings, scalp advancement, rhinoplasty. Those are for the male to female, and female to male transitions would include augmentation, thyroid chondroplasty, chin implants, and a jaw implant. So we also have things such as laser or electrolysis hair removal, there's a different approval process for that, and we can talk about that individually, but it's definitely, it's doable. It's doable. It's a little bit tricky because it's at a network, but there's a reimbursement process in place for that. Vocal training, fertility preservation, tracheal shave, there's quite a bit of services available, and we're broadening our provider base too, meaning that we're getting more service providers who are in network to perform these services, which sometimes has been a barrier. But I've been working on this because I think you can offer services, but if you don't have individuals providing it, then it's really not a service. So, and I would be more than happy to, work with students who, have challenges in that way, because it just takes some time and energy and motivation to go that direction and find the right provider. That's really important in each person's pursuit of care. So I hope that's not too much. There's quite a bit. But
Shireen, and maybe you said this and maybe I didn't hear it, whether it's trans male or trans female, they provide coverage for hormones as well.
Yes.
Can I also just chime in case people don't know that if a person has UCSB, they can also see any of us for free. So that's also covered. So in-house stuff is covered.
And Shireen and I, it doesn't matter what your insurance situation is.
Good point.
At CAPS, it doesn't matter because it's covered through student fees. So
I will chime in that people can see us if they want to pay out of pocket, or if they have GAP, it's also covered.
And if you're confused about any of that, feel free to reach out to me or Shireen and we'll help.
It is a lot. It's a lot. So it's not your imagination. And I apologize in advance for the complexity of it. But we'll help you navigate that.
And on the topic of insurance and changes to insurance, I want to say that some of the changes that happened in the last year have to do with the work of trans students who served on the insurance committee. And that is something that if you're watching this video, you can do yourself. And it is not especially fun to serve on a committee, particularly a committee that talks about insurance for a year. But you can have a really profound impact for yourself and for students like you. So if you're interested, I guess reach out to me. I'm going to put my email in the box. I don't actually know how to join that committee right now, but I will find out.
Yeah, we made a whole list of recommended language change to the way that just their actual policy is written, so that it was, you know, language really matters, and you do have to put a little bit of blinders on when you read the documentation as it is. So we suggested that to them. They were open, but I think if we could get, you know, more people who are the utilizers of that insurance, more students out there and advocating for those changes, that would be really helpful.
Thank you.
I'm sorry.
No, please, go on. Sure.
No, I forgot to mention, there's a lot. Travel expenses are also covered under certain requirements. If it's over 50 miles away where your surgeon is located, there's reimbursement for some of those travel expenses, which is also, I think, you know, a good thing for sure, because, you know, there aren't any providers in Santa Barbara proper, unfortunately, right now. But, you know, there's a lot of providers both in the urban areas, LA and San Francisco, but there are closer in, like Thousand Oaks. But yeah, so the travel piece is somewhat of a challenge. And if you have a specific provider, say that's in San Francisco, you know, there is reimbursement for that piece. And you can make that choice to see a provider in San Francisco and say, well, I'd rather see that provider than somebody in Thousand Oaks. And there would be some sort of reimbursement in place for that choice for travel.
I wanted to mention something else, not insurance related. Sorry if it's a tangent, but we also can help with any legal forms in terms of legal name change, change of gender, which sadly might be state dependent. But we're happy to help with any of those legal forms if you need help with that.
I had a more of a question for the medical folks here, just because we see students when they're getting these letters, and sometimes their plan is to have surgery over spring break, or you know, the winter break and what have you. And I'm wondering if you can just address just some timeframes around recovery in general. I know a lot of times there's a push to get this done. I'm going to graduate next year. I need to get it done by then because all my insurance will run out. So anyway, I wonder if you'd be kind enough to address that a bit.
Sure. I think it can be pretty variable, but for affirmed women who would like to have like a breast augmentation, that's a pretty quick recovery. You can recover from that, I would say, in a week or so. You could probably be back at work or school. However, for trans masculine people who would have top surgery, the removal is a lot more complex, and it also depends on your surgeon. It depends on the type of surgery that you have done, how much tissue was removed. But I generally tell people, like, expect to be T-Rex, you know, for a while. You can't move your hands over, and oftentimes there's these drains that are involved. there can be some significant pain involved, and so sometimes you need to be taking medication. And again, this is very person to person dependent. But I would expect, you know, a couple weeks of needing somebody around to help you a little bit, and probably not being able to focus on schoolwork. Bottom surgery is like a whole nother level that takes months to recover from, and is pretty significant. The complication rate is pretty high on those, so you're going to be needing to do like frequent check-ins, and that's something that if you have your surgery in San Francisco or LA, you can come to us for check-ins, and we can be in touch with your surgeon, and we can manage most complications. Can be managed by us at Student Health. With top or bottom surgery, really. But I would say you need to plan, you know, for any kind of bottom surgery at least a month of recovery time, and then just know that you're going to be, you know, in a maintenance phase for quite some time. With the facial feminization surgeries, those are really variable as well, but generally pretty well tolerated and pretty easy recovery from a surgery, probably a week, knowing that you would still have some bruising and swelling after that. So does that help?
Yeah, that helps a lot. And I'm just wondering, Shireen, so right now we're just writing letters for top and bottom surgery. So there's not going to be any letter requirement for, facial construction or anything like that you're aware of?
Let me look at my new handout here. I don't think there's a letter for that. There is a pre-certification process other than that, and it goes along the same lines as electrolysis. There needs to be a referral. There needs what we talked about before, but it doesn't require a letter from a mental health clinician.
Okay.
Thank you.
That's a step in the right direction.
Yeah. So yeah, if any of the other panelists have questions for each other, that's great. Like let's make this conversation a little bit more organic. But I know there was a question around, like, at Student Health, how would someone bring up that they want to start hormone replacement therapy at a routine visit?
As Erin said, this is part of the primary care paradigm. If you look on the website and you know that your primary care provider is already part of the trans care team, then you can be absolutely confident that you could say, I want to start HRT, and they will know what that means and be totally down. Everybody that you would be seeing as a primary care provider probably knows the term HRT, but if not, you might want to try something a little bit more explicit that says, like, I want to start estrogen, I want to start testosterone for gender transition. And at that point, they will either be able to say, like, yes, I can start you, or I need to consult with somebody, or I need to refer you, depending on whether that person is at that place so far. Any thoughts from medical folks you might want to add to that?
Well, the only thing I want to add is we're hopeful that at some point it'll be on the website, that it can actually guide people how to get to that point and get those questions answered. COVID kind of took a lot of stuff away from us. So right now we're not doing that on the website, but in general, that's one of the things we're working towards.
We should make Ali do more videos.
COVID ruins everything. It's my mantra lately. But I would say, yeah, if you are in a routine visit, if you're here for, you fell off your skateboard and hurt your knee or whatever, you can just ask. I think that I'm not a patient, but in my experience with every single healthcare provider here, they're pretty approachable and pretty reasonable, and we do try to give really comprehensive care. So usually as we end our meeting and clean up your knee, we'll say, is there anything else I can do for you today? Do you have any other questions for me today? So usually, and you can say, I want to talk to somebody about this, or I heard that you guys do hormones here. And you know, they can connect you with maybe Erin or Dr. Moore or myself, or another member of the team to kind of get you guided down that path.
So for the medical folks, if a student calls and just says, can I see Angie or can I see Dr. Moore, without explanation, can they get scheduled?
Yeah, no questions asked. They do not have to say a reason. You do not have to say a reason. You could say, I want to, my friend sees Dr. Moore. I want to see Dr. Moore. I heard Angie on a webinar. I want to see Angie. Yeah, you don't have to give a reason at all.
With that said, if you do let them know that it's trans-related intake, they'll make a longer appointment. So there are also, there's trade-offs of saying versus non-saying.
Right, and probably somebody later will
say, I need a longer appointment, they'll give you one.
Yeah, and probably somebody eventually will give you a call and say, oh, I see you're scheduled. What are you coming in for today? And, again, if you just say, I have, some confidential matters that I would like to discuss, or I just have some questions that I want to talk to the medical provider about, nobody's going to push you on that.
And I'd like to just add that you can also do this without an appointment. We should all be reachable and accessible through the student health portal. So, I've had people send me a message who I've never seen before, and we're happy to receive those and answer them as and direct you, to whatever you need. So you can also just send us a message via email through the portal.
I just want to segue to this because I stand to be corrected. I made a mistake, and in reference to Janet's question and to the audience, I apologize for my error, but I want to correct it so this is clear. So for the new, facial gender confirming surgery, I misread it. It actually requires 2 letters from a qualified mental health professional. So 2 letters, such as would be required for bottom surgery. So I expect that there'll be more letters being written in that regard. And that's an important piece. So I apologize up front, but I want to correct that. It's 2 letters. And Janet, did you get that message loud and clear?
I haven't. Yeah, thank you. No, I hadn't heard. Well, I know this is all brand new. This doesn't start till this 27th. So. Of September. That's interesting.
Yeah, I guess I was jumping to, I was hopeful that it didn't require more hoops.
Yeah.
But.
Well, I'm surprised just because people in general have facial surgeries, and I don't know that they require letters, but such as it is.
Yeah.
It's great that we have 2 that can write letters. So there's the 2 psychologists here on this call. So we talked a lot about, students wanting how to talk to their student health services around accessing trans-affirming care. And I know a lot of students have a fear around talking to their doctor or their nurse, right, around trans things, because the healthcare system is inherently transphobic. As we're, jumping through so many hoops to get life-saving surgeries. So one of the questions from the audience was, what sort of training, if any, do healthcare workers receive regarding how to treat trans patients with respect and dignity? Do you think training could be improved? And if so, how?
So I'll tackle this one. I'm not sure who you're pointing at. We're in different orders for each other.
Oh, you. You.
It looked to me like you were pointing just really aggressively at Craig, and I was like,
oh no. But Craig, yes. We love Craig too.
Fabulous. Yeah, so this is a big part of my job. So one of the things that we make sure happens is within, I should say prior to COVID, we made sure that incoming staff would definitely get a Trans 101, a 2-hour small group training with interactive practice within 3 months of joining. There has not been one of those in the last 6 months. So I will be fully transparent. COVID changes everything.
Everything. Say COVID ruins everything.
Yes, agreed. It's the worst. I think we should stop immediately. But under normal conditions, clinicians get a 2-hour interactive Trans 101 for clinical contexts. Basically immediately upon arriving at UCSB, they get a refresher periodically. We're moving toward the onboarding also including training on implicit bias so that people have practice not just understanding and recognizing what stories they tell about people outside their community, but also, again, practice-based. So learning specific techniques for addressing those stories and hearing them less, or learning how to bring in alternate interpretations of the situation so that they're not accidentally leaning on bias to make decisions that could adversely affect patients. And then that's kind of the like, everybody gets it. And then as we go, as things come up, there'll be kind of deep dives into whatever seems necessary. So pretty soon after I started working at UCSB, I did an evaluation and saw kind of what are the beliefs and attitudes and knowledge points of the staff as a whole, and what are they confident and less confident about. And it looked like people were less confident about sexual health as pertained specifically to queer women and trans women. And so we did a workshop specifically about queer and trans women's sexual and reproductive health. So we talked about like what STIs are lesbians more likely to get than straight women and vice versa. What are the specific practices, healthcare needs of different populations? And even like talking about doing vaginal prostate exams on trans women with a vagina, because it's actually more accurate and can be more gender affirming than the way that a cis man would get one. So yeah, it really depends. The training is ongoing. There's obviously no end to the topics that we could cover. There's so much that we could know. And so it depends on like what's coming up, what feels, sometimes it comes from specific requests from staff where they'll say like, we really want to learn about implicit bias. Can you talk about that? And I said, yeah, I can. And sometimes it's like, I've recognized that there's a little bit of a glitch here, so let's talk about that. So it depends. But I did the math on like how many hours of training we had done in the last couple of years, and it was just a phenomenal number. But really, typically I'll get 1-2 hour training every 6 months. That's a unique training on top of the training that everybody gets. So it really is a pretty good amount. And that's on top of the training that the staff is getting in other topics. So they're constantly learning about, I'm trying to think of like some of the great things that I've attended. So we've got lectures on like traumatic brain injury and eating disorders, and just, it's phenomenal to have the opportunity. We get to be constantly learning. So yeah, we are constantly investing in new trainings of all different kinds. And toward the very beginning of this process, we also had guest lecturers at different university health systems about how they had created trans care teams, the sort of different ways of approaching building trans health supports in a university environment, and talking about what works, what doesn't work. So we also created that same kind of network of care at the higher level. So in addition to being in a network with each other as individuals, we're also in a network with the rest of the UC system and with trans care teams beyond the UC system. So we get to have those, well, what are you doing? What are you learning on a lot of different levels? And I also want to say, we're very clear that trainings are an important part of the process, but trainings are not the whole process. So often, and I'm excited to see this, there's an increasingly loud critique that I'm seeing that, you know, trainings are not the solution to racism and transphobia and the social problems of the world. We can't do a 2-hour training once a year and say like, all right, we're done, we fixed racism, because that has not worked. And with trans care, it's exactly the same. If it's just a 2-hour in its own pocket kind of thing, we could do one once a week and it wouldn't help. It's all about a strategy of practices and creating a culture. And so I think it's important that we have these trainings, but it's even more important that we have a mind about how to create a culture of care. And I think the fact that we've got the 6 of us in different disciplines on this call together is really a sign that that's how this works. It's not about, you know, we've got one expert. It's about, we've got shared investment.
I can chime in a little bit about personally the kinds of trainings that I get too. And there's a community of dietitians who are very interested in working with, of course, eating disorders, but also trans people in general and eating disorders. And so I'm in network with those individuals across the country as much as I possibly can be. COVID ruins everything. And it's just, we're trying to continue to meet and talk and support each other and also just get more information. There's not a lot of information, but the information's very clear that people, trans people have like 4 times the incidence of eating disorders and body image issues. So we keep working to make things a little bit better and keep reaffirming and using the right ways of approaching this.
So if a student has feedback around how student health navigates supporting trans folks, who would be the best people for them to contact?
I'm giggling. We actually are going to put something on the website where people will know how to lodge anonymous concerns. The more specific, the better, because it's very difficult in a place where there are over 120 people working. If there's generalities, because we know that there are people there who are trying really hard to be as affirming as possible, but then people mess up, and we have some computer systems that are not super friendly, and so we run into issues frequently. So there's going to be some place on the website, but there's also currently a QR code on the front page where people can do the same thing. And if all else fails, send me an email, because I will make sure that it gets addressed. It is part of my other duties besides being a dietitian is patient satisfaction surveys.
We also have an advocate line that goes straight to Betsy. It's the Student Health LGBTQIA advocate line, and that number is 805-893-3368. So you can call that and you can leave an anonymous or non-anonymous message. Also, there was a chat question that I'll just address now about how are we handling appointments now that we're potentially being remote. So at Student Health, all of the providers are seeing our students via Zoom. So, and a lot of us are actually only in the clinic for a portion of the week, and we're working from home, doing Zoom, staying safe. And if you happen to be like out of the city or out of Santa Barbara and you're in California, we can easily also prescribe medications and prescribe any lab work that needs to be done. If you're outside of California, it might be a little more challenging, but I'm up for that challenge. We're also up for, taking case-by-case basis about, what do you need, and some of you might not need a whole lot of lab work, or you might not need a whole lot of interaction to get started, or it might just be the conversations that we're having, but we're happy to do all of that over Zoom. And you would make the appointment the same way.
And that's true of CAPS too, right? People don't have to be in California.
So maybe Janet could speak more to the not in California. That's really on a state-by-state basis, from my understanding, because we're licensed as psychologists in the state of California, and other states can decide whether or not practitioners in California can see people in that state using telehealth. A lot of states have created like emergency provisions for that, but we have to look at a state-by-state basis. However, we are, I think, exclusively providing telehealth services at this point, right, Janet? No one's in, like,
Yeah.
this is my home office.
Zoom and phone is what we're doing. We've been doing that really since March. And what we have done is for folks that are in other states, we will try and get a temporary license. We don't have one. And that also goes for other countries. So we've got a few clinicians that have temporary licenses now for different students. So let us know and we will do our best.
I would just like to mention that if you have any pressing healthcare needs and you're in the Santa Barbara area, that you still are welcome to come into student health and be seen in person if needed, and that I think you should feel safe seeking care if you need. We have all the protective equipment and sanitizers, and I think, to be honest, student health is doing a great job of keeping students and faculty safe. So if you do have a healthcare need that can't wait, don't ignore it, and we're happy to see you, and I think you should feel welcome and safe.
I have an on behalf of others question. One of the questions that I've heard come up from transmasculine people is it safe to bind during all of this COVID stuff?
Yeah. Meaning like the respiratory perhaps effects, like breathing. Is it safe to bind during COVID? COVID ruins everything. It is safe to bind if you do it safely. So being in a binder 24 hours a day is not safe. It needs to be removed. You need to do some lung expansion exercising. And that can be a good trick is like blowing up a balloon, like blowing a balloon. So that really gets your lungs exercised. But you need to really periodically spend time out of the binder. I can't say that would be any different without COVID though. That kind of is a general rule. You don't want to spend too much time in there. It can constrict your breathing, it can constrict your musculature, it can constrict, and it can break down the skin there as well. The same thing with packers. You want to periodically take those out, let everything kind of reset, wash, etc.
So I think the next question, so there are, students who graduate, but still stay in the Santa Barbara area and lose, some of the resources that they count on when they're a student, specifically CAPS, right? And so a question that was asked was like, where should I look to find good therapists who understand trans, non-binary, and gender non-conforming issues in Santa Barbara?
I'll chime in about that. So I work with students as they transition out of university. There's, I work with students right now who have graduated until they're safe and sound in their next stage. And there's no charge, of course. And I can also help students connect with community providers, therapists, and work with them individually on that.
I think Han said that they are providing care in the community. Is that right?
I'm not currently. I was up until Wednesday. But I can recommend my field supervisor, who's Max Rorty, who's at the IV Neighborhood Clinic. There is also Patrick Lyra at, Patrick Lyra, who works at Pacific Pride. Pacific Pride has a number of clinicians. Patrick Lyra has a private practice. And I think they're currently the only licensed therapist who is out as trans in Santa Barbara. so they're a great option. There's also, I know a lot of students who've had really good experiences at Acacia, and I know that they have worked really intentionally to create a trans-friendly environment, including having me come and lecture them about trans care. So I know that they're really doing the work. And there's also psychologytoday.com has a like provider finder, which is useful anywhere you are, and you can actually search by a ton of different categories, including show me only non-binary people. So if you're looking for a non-binary provider, that is now an option. They don't have an option to search by providers who are trans. Hopefully they will, but they just added the non-binary one, so that's really exciting. And they do have, like, people will talk about their expertise, and so you'll see people. In my own search, I found that if you're looking for people who are really knowledgeable about LGBTQIA topics rather than wanting to be generally inclusive, look for people who say that they serve bisexual rather than gay. Because kind of everybody says, yes, I will take gay clients, but the people who list themselves as specializing in bisexuality made a choice. That's not like a scientific opinion, that's just a trick that I personally use.
I don't know, Han, if you mentioned Pacific Pride as well. Yeah.
And just for the record, CAPS has been seeing students who graduated through the summer. So we'll usually see students until the next quarter after they graduate. Actually, not usually, we've expanded that. So.
That's really great to hear. I didn't know that. So that's good to share with students. You know, with accessing trans affirming, like healthcare specifically, there's a cost to it, of course, even with insurance. Especially I'm thinking about gender affirming surgeries that can cost in the thousands. I'm wondering if y'all maybe can speak on how you support students with the financial piece of it. Because I know y'all are experts in your own field, but I like to think we're all social workers in some aspect or another. So I'm wondering if anyone has any experience in supporting students with that financial piece of trans affirming care.
That's a good question. I wish there was more support out there. Can't, off the top of my head, I can't think of it, but there's a few funds or grants for gender affirming care, surgeries in particular. And I can't remember the names off the top of my head, but I can get that information to you, Quinn, and then you can probably pass it along. So there's two in particular that I've directed students to request. It's sort of a grant or a scholarship, and it's a national-based organization. Those are the only two that I know of, but I'm always open to learning about more.
Yeah, so just as FYI, all the links, all the phone numbers will be added to the YouTube description. So once, Serene, you send me that information, that will also be accessible on our YouTube channel.
Mm-hmm.
We need a benefactor.
Yes.
I think for I can speak a little bit on supporting students with financial, the piece of gender affirming care, specifically with surgeries. So I know EOP, if they are EOP student, which not all students qualify if they're not first gen low income. EOP has a medical emergency grant. It's up to $1,000, I believe, unless that has changed with COVID, but I will make sure to clarify that and put it in the description. So they would just meet with the EOP counselor and talk through that and see if they qualify for that grant. Another option is SMRF, which I don't remember what the acronym stands for. Does anyone? Student
Medical Emergency Relief Fund.
Thank you. Oh my gosh, thank you, Shireen. So that is also for medical emergencies. So students can apply for that grant.
Are they approving trans students now?
They are going to, yes.
Oh, that's great news.
Yeah, so it just depends. I think the conversations are around time, like how long is this, when is the surgery, how close is it, have they explored other financial options, things of that nature. So those are two of the ones that I know. And then the financial crisis response team also. So if you are a student listening and wants to have surgery or hormone replacement therapy or any other gender affirming care and are worried about the financial piece, the financial crisis response team is a really great start. And then they can get connected to other resources on campus. And it sounds like Shireen Bar can also support in trying to find some national resources. So I think we're getting to the last two questions. So if folks that are listening, if you have additional questions, feel free to put it in the QA. But one of the questions, which might be a little hard in a Zoom format, but it's like, how can students get connected to you? So what I will probably do is maybe you can send that information to me and then we'll put it in the description of the YouTube channel. Maybe that will be a little bit easier than people having to jot down your email addresses. But does anybody have any like initial thoughts about that other than just sending me your contact information?
Yeah, at CAPS, all the clinicians are on the website. And you can just contact us, through our online request form or calling the number.
All of us are on the portal that I listed earlier, so you can contact us through the portal, I think. At least most of us are, I'm pretty sure. Some people opt out of it. So
through the portal as well, yeah.
Everyone except me.
And how would they get connected to you, huh?
Only email at this point, because I'm not physically on campus and not on the portal. So email me and yeah, we can meet via Zoom or just chat on email. Yeah.
Awesome. Thanks, everyone. And I think our last question, unless audience have additional questions, is if you have any, do you have any last thoughts as we wrap up our panel together?
I have some, I'd like to bring it to the audience, that I would love to hear feedback about their experiences with providers, with surgical and service providers, because that would be of great value to the UCSB community who helps support you. And I would appreciate it just for myself. That would be, I'd like to be able to get more feel for it, are you getting your needs met? Do you feel comfortable in that surgical medical provider relationship? And if you're happy with the outcome. So, that information, if you could send it to me through secure message, through Gateway, or we can have a conversation about it, email, whatever is easiest for you all to provide. I would appreciate that.
The same, any kind of feedback about what might be missing, what we could do. Off the top of my head, I think sometimes it's really helpful to talk to somebody who's, been through something that you're thinking about. Like I started testosterone and this is what my experience was. I had top surgery, this is what my experience was. Understanding that everybody's experience is different, but sometimes it's really nice just to hear that from somebody. And if there's that need out there, that want, we can work to connect people together or set it up in a group format or be creative in whatever way. But that would be something that I would think would be really helpful.
I think also Betsy made the really excellent point that being very specific with negative feedback is really helpful because it can be more actionable with the systems that we have now. It's also really helpful to be specific with positive feedback because often positive feedback is really vague and people will just say like, it was good. Or like, I saw Betsy and she was great. And it's like, Betsy is great. We all know about that. But like, tell us what was great about your time with Betsy. Because if we hear Betsy's great, we can't share that with, we can share that with people. Dear everyone, Betsy is great. But if we hear like, Betsy really helped me because she made sure to always use gendered language that really reflected where I was in my process, and modeled that it was really normal to be unsure about the next step. Like if you can, whatever it is that you can share about like what felt great about your experience, that's also really helpful, because especially because it doesn't need to be a secret. Often with complaints, they need to be handled in a really private way with that person, which means that other people don't get to learn from their mistake necessarily. Whereas a positive thing can be shared really widely. And so we can say like, we got 3 different emails this month about how great Angie was about being really patient and holding time with students, and they felt so valued by not feeling rushed out of the room. And that allows us to say like, hey, it really helps when people don't feel like you're in a hurry and when they feel like there's time to cover all of their concerns. So if we know those specific positives, we can do a lot with that and try to make sure that that experience happens for more people.
And I think as a consumer myself, that's oftentimes asked to give feedback. Like that's my time, that's valuable, and I respect your time too. So sometimes I wonder, maybe just picking up the phone and using that LGBTQIA resource line that I said earlier that Betsy answers, and just, taking 30 seconds just to say, your experience like Han just did. That would be really invaluable to us. And it's really, you can think of it as really kind of paying it forward to other students, so that we can just really understand what we need to do to be the best that we can possibly be.
Any last thoughts?
I think on the topic of feedback and valuing your time, I think often people, particularly younger students, don't kind of know you're the boss and you don't have to be in any of our offices ever. If it's not working for you, if you're having a bad experience, you can always leave. You can always say, this is not feeling good for me because X. You can always say, I actually decided that I don't want to continue this until I can get an advocate in the room. If it's not working for you, you don't have to sit through it. You don't have to keep seeing that person. You can get a new therapist. You can get a new primary care provider. You can see a different, that is always, always, always your choice. And that's not just at UCSB, but that's everywhere you go. That is your right as a care seeker. So I want to encourage you that, you can break up with your therapist. You can get somebody who fits your needs better. And that doesn't even have to be necessarily like they did something wrong. It's important, that relationship is important. And so it's always okay to make sure that you're in a room where you feel like you can get your needs met. And we are always going to support you in that. And it's okay. And we've been there before. It is not our first time having somebody go, this isn't a good fit. We can hold that. And it's absolutely, absolutely always fine to say, you know what, I actually have to go.
I just want to echo that too, Han, with, if you don't, I tell students that it should feel comfortable, and, just if there's a gel or what have you. And if it's not working, it's a no questions asked. We might just say, to make sure that there was nothing inappropriate that happened, we'd want to check that out. But, we have an online request form. You want to change the therapist, done.
And I think Han said this earlier, that there's no test for transness or something like that. Like, you're not coming to us and we're not telling you you're not trans enough, or here's, take this quiz, and this is going to tell you whether you should or should not start hormones, or whether you are really trans. Like, it's not a contest, it's not a test in any way. Again, we're just here to let you know what's available and to keep you safe and keep you aware. But I think there's a lot of that fear of judgment, or a fear of, oh, I have to go in and say these 5 things that I read on Reddit, that this is what you have to say to get hormones. There's none of that here. This is a conversation. This is open. Yeah, don't be scared. It's not a test.
Or be scared. That's okay too.
Or be scared. Yeah, or be scared. And like, I get scared when I have to go see my healthcare provider, and I feel like, oh, I'm going to say the wrong thing. It's normal to be scared, but just know that we're not here to put you under a microscope and make you prove that you're worthy or that you are trans enough.
I would just like to say one more thing, and that's that this is an evolving field, and you are students and researchers and academic people, and new things will come up, and you might know new things ahead of us or more than us on a topic. And we are happy to have the discussion, do research with you. We want to meet you where you're at. If there are things that you're interested that we cannot provide, we are connected to a broader community here in the Central Coast, really, and we can try our best, and we have contacted other providers to get you the resources you might need. So please feel comfortable coming to us with any questions or wants or desires, and we will do our best to be your advocate.
Thank you so much for pointing that out, Erin. It's so, it's kind of such a healing moment for me as a trans stigma researcher to hear that from an MD particularly, that I know a lot of people are in the position of feeling like they have to fight providers to get them to read the research, and I know that you aren't like that, but I also just love that you want everyone to know that this is a great team, and there's been a lot of work over the last several years to make it a great team, and it just makes me really happy.
Kind of adding on to what Dr. Moore and Han have been saying, I feel like this for me is an emerging area where I have learned a lot about trans issues in the last 3 years, and I learn a lot from my students. Like, they are my great teachers, and I don't have a trans identity, so that's not something that I share personally, but most of the time I don't share every identity with the patients that I work with. And so my training and my approach has to be one of learning from the person that I'm working with, and at the same time informing myself and learning through other ways, like the kinds of trainings that Han was talking about, as well as continuing education. And so I'm also humble about what I don't know about this area, and recognizing that it's in flux and in motion.
I think it's a great reminder that, right, we all have a stake in gender, because we all have a gender and we're all navigating our gender very uniquely. So I really appreciate your time and your dedication to supporting trans, non-binary, and questioning students. We're such a great campus that really has a great team. So for the folks that are in the audience, this is your team, and I hope that you feel comfortable enough reaching out to them, because they are here for you every step of the way. Sorry, that's my dog. But they're here for you every step of the way, and I hope that you will reach out because, you know, UCSB is better because you're in our campus and in our community. Thank you so much for our panelists. Thank you so much. And then we will add this recording to our YouTube channel next week. And I hope you all have a really great weekend. Thank you so much again.
Thank you.
Thank you, Quinn.
Thanks, everybody. Thanks, Quinn.
Thank you, everybody.
Thank you.
Thanks for having
Bye.
us. Thanks for